Carter is a certified peer specialist and the alumni coordinator at Skyland Trail. I know you've been there for about 3 years, you said. She's an advocate and public speaker who is passionate about educating audiences about mental health and wellness. And her story, which I thought was fascinating, is highlighted in the best-selling book, You Are Not Alone, The NAMI Guide to Navigating Mental Health. Tara, really glad you're joining us. Next, I will go to Dr. Ben Hunter, is a psychiatrist and Charles B. West Chief Medical Officer for Skyland Trail. Dr. Hunter is an elected fellow of the American Psychiatric Association, treasurer and 2024 president-elect of the Georgia Psychiatric Physicians Association, and a member of numerous state and national level committees aimed at improving psychiatric access and care. I think it's the adage of, if you need something done, give it to a busy person, kind of thing, right? Okay, we got that one. Thanks, thank you very much, Dr. Hunter. Ben, great to have you. And Dr. Linda Grabbe. Did I pronounce the last one? I did. It's a real, the nuance. Is a board-certified family and psychiatric mental health nurse practitioner and professor emeritus at Emory University School of Nursing. I think you were there about 20 years or so. Her clinical expertise is in primary care and mental health care for underserved women and youth, and providing the community resilience model training. And I know we had a wonderful meeting earlier today, all about the hundred sites of that is taking place across Georgia today. So I'm going to sit down and join all of you. And what we thought we would do is just have this opportunity for each of you to share a little bit about how you're bringing this concept of resilience into your work. And I'm not sure if we really did decide who would start, but I think, Tara, would you feel comfortable leading us off?
Sure, I would definitely feel comfortable. So as it relates to the work that I do, I'm the alumni coordinator at Skyland Trail, and I'm a certified peer specialist. And so my work is being able to connect with our clients in a lived experience way, because I do live with a mental health condition myself. So I live with bipolar disorder, and so as it relates to resilience and me being able to stay well while also serving in the community that I serve, you know, it's really required me to make sure that I have a high level of self-care. You know, I even tell my clients that, you know, I stay in therapy. It's preventative at this point. It really helps me to keep my stress levels down. And so I need someone sometimes that's outside of my circle to be able to talk with when there's certain challenges that arrive in my life. And I also think that boundaries has been a blessing to me. It's freed me from being a people pleaser. That's something that I struggled with for a long time. So being able to understand that I don't have the capacity to do everything, I can't be there for everybody all the time, but being able to say no when it means that if I say yes, I'm maybe putting myself in a position where I won't be well. So I really had to understand that, you know, in order for me to just be able to serve the demographic that I'm working with, I have to be able to prioritize my own self-care. So,
thanks, Tara. That's, I think it echoes a lot of what we were talking about. Oh, and by the way, I should just let everyone know, if you do have questions for anyone, myself included, I believe what we did was we have left you with white note cards and a pencil. They were all provided, and you can simply write your question on that, slide it to the end of the row, and one of the volunteers will pick those up as periodically throughout this conversation, so that you can feel, you know, we all know it's kind of sometimes awkward to raise your hand inside a large group, so this way you can slide the question to the end of the row, and just we'll push those together a little bit later. So thanks Tara. Dr. Hunter, Ben?
Oh, first of all, I love the trampoline analogy, and I want to send a quick thanks to anyone in this room and everyone outside this room who might be watching or otherwise who have served as trampolines for Skyland Trail and for us as clinicians over the years. I mean, a lot of people in this room who have contributed to our ability to serve our patients, so thank you very much. I'm going to tell a patient story because everyone likes patient stories, right? So many inspiring stories from patients over the years at Skyland Trail, but one of my first patients from back in 2017 when I arrived at Skyland Trail really stands out. And I was a medical director at the time, and I remember hearing about this person coming in, and we would often consult with the admissions department to decide, you know, what type of treatment people needed and which, you know, track they would end up on and which therapist and psychiatrist they'd work with. And this person came in with depression and anxiety, and I remember there was a very clear backstory as to why this was going on. This person had gone through quite a bit of stress at work, had what sounded like a fairly frankly abusive relationship with the boss at the time. She was an African-American female, boss was a white male, and had just been treated poorly for years and had persevered and gotten through it, but it had eventually taken such a toll on her, and she was going through so much stress every day at work that she decided she couldn't do it anymore, and she took a leave of absence. And was really coming to Skyland Trail to figure out what she needed to do to take care of herself, and then what she wanted to do with her career. And we thought in the face of a lot of racially based trauma, culturally based trauma, we had an African American psychiatrist, one of the kindest, greatest psychiatrists we've known at Skyland Trail, Adam Meadows, and he was luckily our cognitive behavioral therapy specialist. So we were going to line her up with Dr. Meadows, and unfortunately, Dr. Meadows was just overstocked with patients at the time, in full beyond full. And we said, do we want to put her on a different track? I said, no, I think I'll work with her. I think I have room on my caseload. And they sort of, well, not sure she's going to do great with you, given the whole dynamic with the boss. And I said, I think we'll work through this. I don't think Skyland Trail is a place where we lean away from discomfort. I think this is something we can do to build resilience in her, and we'll give it a try at least, right? This might go horribly, but we'll give it a try. And I'll never forget, the first day that we met, she came in my office and she walked through the clinic, and I was sitting there with the door open, and a moment I'll never forget, she opens the door, walks in, and just says, "Oh, absolutely not." Just a perfect representation of this abusive boss sitting right in front of her. And luckily, I'm partially hinting at the sense of humor she's had, which has been a huge source of resilience for her. And she walked out for a second, but she came back in and sat down and kind of just crossed her arms and, allowed me at least a chance to win her over and pitch what we have to offer at Skyland Trail in terms of resilience. And what I told her was that at that point we really had two options. And one of those would be to lean into a narrative around victimization and disempowerment, and a potentially, just traumatically oriented life where she would go forward avoiding situations where she had to interact with people like me, people like her ex-boss. Or we could lean into this relationship we could build and the opportunity to look at this incredibly difficult situation she'd been through as a potential source of resilience, and to empower her and to allow her to dictate how her future would be and how she wanted to interact with people like me, people like her boss, people that otherwise might kind of represent all the things that have caused difficulty in her life to date. And she was a great sport. I saw the look in her eye as soon as I kind of offered her that opportunity. She had never been a quitter, and she wasn't a quitter then. We worked together for 6 years. She was right at the edge of going back to work after being on disability for quite a while, and then got a cancer diagnosis. And I will tell you the resilience she showed and sort of the ability to work through that, and she was so worried about supporting her family, in the middle of getting chemotherapy treatments, and she had these people around her, she had these trampolines to bounce off of, she had the supports, but most importantly, she made a choice at some point, and I'd like to think it happened well before we were in the office together, that she was not gonna turn away from challenges. And again, she wanted to be empowered, and she wanted to change her own life, and she saw Skyland Trail as a place where she could do that. So it's been an honor to work with her over the years, and if she gets to see this, I hope she understands how many people she's influenced in her life too. But really a prime example of resilience in my career, where we lean into discomfort and we gain strength that way.
That's a terrific story. Very, and to push into that uncomfortable zone of that conversation. Indeed. If it's okay, I'll move on. Dr. Grabbe.
Okay, so glad to see you all. I'm a psychiatric nurse practitioner, but also the parent of a graduate of Skyland Trail, and so I've been very grateful for a long time to Skyland Trail. So in my clinical practice, I took care of women who were in drug treatment here in Atlanta, or who were in shelters, and young adults who were without shelter. I could not get them seen very often to have therapy, even to get on an antidepressant. We don't live in a very kind country, and the people people who were the most traumatized were actually the least likely to get the attention that they needed, those resources that you talk about. So I went back to school after I was 60 and became psychiatric nurse practitioner. Better late than never. I'm not sure what I thought I could do, but I did come across a very valuable resource, which is called the Community Resiliency Model, which is not psychotherapy. It is simply some emotion regulation techniques. Yes, it's a kind of mindfulness because it's present moment awareness, but it's somatically based, so sensory, so very sensory, which is pretty important for dealing with trauma, actually. So for the last several years, I've been sort of devoting myself to, my two passions are the women in drug treatment and high-risk adolescents. I teach this material, which I'm going to share with you all through the folks here will share some information because we're doing a webinar on Wednesday, which teaches these sensory awareness skills. So it's like a high octane mindfulness. It's like going straight into the HOV lane, and very powerful research results with randomized controlled trials. But our passion right now is we're teaching kids who are incarcerated in the state of Georgia, throughout the state, who have done really bad things, and they can get a long sentence even at age 12 or 13. So I feel like, although we can all use wellness skills and to build up our resilience, our individual resilience, but I think this type that we teach also brings in the environment, other people, because there's this shift that happens in the brain when you pay attention to sensations. So that's kind of my passion.
What's fascinating about that model too is that you're reaching a population that we would stereotypically think would not want to be reflective or be tuned into their bodies, largely because of the amount of trauma that those kids have often experienced to get to that point of being in jail quite early in their lives. But also really thinking about, needing to find ways to reach them. And I know when we were talking earlier today, you said that they were remarkably receptive to that intervention, to if you're making something available and accessible at a time in their lives where they're probably a little bit calmer, safer, or housed and stable, they will take on these people will take advantage of what they're offered sometimes.
Yeah, and our research so far on probably 100 kids, we've taught over 250 already. This is something I want to do until the day I die because it's so exciting to give them some tools that they can use for self-regulation. But what we found was a decrease in anger, and they have really good reasons to be angry, right? And decrease in PTSD symptoms. So we're on a good path, and I'm gonna really borrow heavily from your publications, and these images are just so important to understand this big picture.
Well, I think I'll just bring people back then to that idea that, when you understand what someone is dealing with, the risks, the challenges, and what kind of outcome you're trying to achieve, then often it becomes easier to script out to figure out what is the right mix of protective factors. And Tera, you seem to have found that balance between self-care, but also about reaching out to your community, reaching out. I think sometimes when people say self-care, I've had this kind of little tweak a little bit sometimes. It's like, well, you're just doing it on your own. You're just self-caring. And I think sometimes we forget that self-care usually means I'm getting myself ready to also be in community and be in relationship and be connected. And at this point, really, it was just a conversation for us, and then we'll open up for some questions from the audience as well. But any quick reflections on anything that you've heard?
Well, I definitely would say that I believe that having a strong support system, support network is one of the biggest reasons I feel like I've been in long-term recovery. I think what I've learned though is my support network's ability to hold me accountable is contingent on me being vulnerable with them and being honest with them about the things that I struggle with. And so, I have different people in my circle that help me with different things. I've been able to identify their strengths and so even when things are highly stressed, I have a code word that I use with some people where they know that if I just send this code word out that I just need you to check on me maybe. I might need you to check on me, but I do think that if I didn't have the support network that I have, that I wouldn't be as far as I am today. So it's just very important because when life starts lifing, is what I say, we gotta have people around us that understand the dynamics of, what we're going through, living with a mental health challenge and kind of what our warning signs are, what are some of the things that we tend to do. I know with me, I tend to start withdrawing when I'm under a lot of stress. So, I have a group of friends, if, we're on a little group texting, if I'm not texting in the group text, then, someone's gonna call and be like, are you okay over there? Is something going on? And so, I do think that connection is vital to, being able to be resilient and be able to do the things that we wanna do.
Would you folks be okay if can I put back that slide with those 12 things, just as an orienting? Because I know sometimes I show that fairly quickly, and if our David up in the control booth would mind, I can just go back in my slides. And the reason I'm just gonna keep that up there is just as an organizing, is that working? Is that okay? You got it, okay. Well, we all need community, right? This is, we all need technical support. Tara, when I've been so honored to work with many people throughout my career, and really wise people have, I think, brought me along. And when I'm hearing stories like yours, what I love also is the fact that it's not just one person, right? Like, did you ever find that bias? We always say, oh, I share a lot of stages, and sometimes I'll have somebody, preceding me say, you just need that one person to love you. I go, actually, in my studies, that's not true. We find actually lots of people who have communities of people, like where, it doesn't just have to be that one true love or that one intimate partner. I mean, I don't know anything about that part of your life. I'm not trying to say that but I think sometimes we forget also that those other many supportive relationships, the birthday person at work, the person who remembers people's birthday, the barista who remembers your order at Starbucks, even if you are the extra frothy soy latte with this extra whatever, and indeed the people that track us in our social media remember to connect with us. I think we don't always shine the light on their contribution enough to our well-being. Any other points you want to jump in on? I can.
Yeah, I think mental illness can be so isolating for people, and one of the hardest things to do as a provider, but especially in Tera's role in the alumni program, is you balance this community and support without leaning into illness as identity. And I think that's so important for patients to move through. And in many cases, patients have been working through illness for years, sometimes decades. And they really have formed an identity that largely includes being ill and the sort of disabilities they've incurred as a result of being ill. And the work that Tera does, and she's so good at setting boundaries with patients and holding them accountable, because really, accountability is such a key part. I'm so glad we're covering this tonight. I think the misconception about therapy or about mental health treatment or medical treatment maybe overall is that, but we'll talk about therapy, is that you go to therapy and somebody sits across from you and they tell you it's all gonna be better and you're doing okay, everything's great. And I will tell you, that is not worth your money. And if you are doing that in your therapy, please, come find us for some new recommendations, referrals. Therapy is a balance between validating patients and their experience, but also pushing them. And I always tell patients when we first start working, if I haven't made you uncomfortable in the first few months, we should probably think about what we're doing here, whether it's a good fit. But there's this discomfort again, and leaning into that. And I think, one of the quotes I've always loved in therapy and held very tightly in my own life too, is that you can either choose your own pain or the universe will choose it for you. And I think leaning into areas of discomfort, ideally by choice, the things we do, like, again, participating in mental health treatment or working out, or, making that decision not to be on social media as much, the things that just cause little bits of discomfort every day, making that decision not to do drugs with your friends as a teenager, even though it might result in being socially ostracized. Every time we lean into discomfort and away from comfort, we gain a little bit of strength and resilience. And I think it does require a lot of support, and it requires role models and people around to support those decisions and both hold you accountable, but then also applaud those small victories too.
That's a very good point, that even resilience can be slightly, making those changes are going to be uncomfortable or require you to find new supports, new people, et cetera, et cetera. If I might though, one of the other things that I've been a little bit surprised by is what I've been writing about recently is a little bit of this idea that resilience is always good. I mean, we're sort of presenting it that way, right? It's positive, it's good, everything's, we want people to be resilient. But I think, you kind of hinted here at something, right? That effort to be resilient, we now understand also has takes a biological toll, something called allostatic load. It goes by other terms, and it's been tracked into epigenetics, et cetera, but basically the best way, it just kind of gets underneath your skin. What Gene Brody, a researcher in the US, has talked about is a skin deep resilience. It's like you can be perfectly functioning on the surface, but then this effort to always be perfect, this effort to always cope, can actually wear down those internal systems. And then you see people crash and burn. The most typical story, of course, is the university student who does incredibly well, striving, coming out of whatever situation. They hit first year university and it just implodes. And that's we often see also the early onset of mental illness. That's a critical moment. But part of that is accentuated by the stress of coping. And I don't think we often necessarily talk enough about that aspect of it, especially if your community doesn't, if you're doing it all on your own, I guess, is often the symptoms.
Yeah, so one of the points that has been brought up about resilient communities is that there are communities who don't want to be called resilient. So for example, this came up in Northern Ireland where because of the Troubles, there was continued animosity between neighbors, but and needing community services, but feeling like when the community is being called a resilient community, i.e. they don't need services, and that's not a good thing. So that is kind of a more negative take on this wonderful concept. We all want to be resilient.
Absolutely. And I saw other heads nodding as well.
I mean, what you just spoke of is definitely something I can connect with because, being a Black female, culturally, we're just being conditioned to just push through everything and pushing through and not really paying attention to our bodies and what's going on with our bodies. And so we do get to this place to where, there's this breakdown that happens, and some of us, we have a mental health condition and the stressors of life is caused that breakdown to happen. But for a lot of people, it's just because the consistent wear and tear of stress over the years, getting you to a place to where you're just not able to function anymore. And so I definitely can, relate to that being a challenge. And that's one of the reasons I do enjoy what I'm doing, is because I can see that sometimes in, some of our alumni that they've been conditioned to kind of function that way, and getting them to, take those pauses to be able to say, okay, you said your body is feeling like this. That's an indication to pause that something might be going on, or even when we have clients come in who are very high functioning, very type A personality, and they're just used to just being on the grind all the time and don't necessarily see how living in that way is connected to them having the symptoms that they're having with their mental health. And so I do think that we have to learn that there's times when we have to pause, there's some times when we have to quit, that it's just not always in our best interest to push through everything, so, yeah.
And in fact, Tara, if I might, I know we'll get to some questions, but there was a question almost specifically, so I can just put the panel, you know, the question was, can you discuss the challenges as a CPS?
Certified peer specialist?
Sorry, okay, it's just the acronyms are different jurisdictions. Trying to maintain your own resilience while balancing the intensity of your work with the clients. I think you're very close to answering that, but does it infiltrate the work then more specifically with your clients?
I think that it does, and that's a very good question. You know, I think that, you know, that when we go in to work, you know, we never know what type of week we're gonna have. But for me, you know, I might have one week where I'm meeting with clients individually and it's really heavy, right? And so if I have a heavy week with clients, and that means personally for me, you know, I might have to take more time for reflection, mindfulness. So I may not be one to go out and, you know, kick it with my girlfriends. You know, I might need that time to tone down, you know, go walk in the park and do something reflective. You know, so I do have to, you know, be able to look at what's going on and the, you know, the amount of events we may have, that we have going on, or even the personal phone calls and the text messages, because those come all the time. And sometimes, you know, I don't have the capacity to respond thoroughly every time. So sometimes I just have to respond with, you know what, I'll be back in the office on Tuesday, let's set up a time to talk about that. So it definitely is one of those things where we have to have strong boundaries, you know, strong boundaries, know when, you know, something is urgent where we do have to respond to it right away. But then there's other things where, you know, it can wait, you know, because we do need that time for ourselves. And so it's a delicate balance, you know, that happens. And I think a lot of the alumni, they know now that I will get back with them, but sometimes it's not gonna be right now. You know, this is something where, you know, you can wait till tomorrow, or you can wait till Wednesday, you know, and I'll be able to sit down with you and give you, you know, great time, but I need to be able to make sure that I'm able to do that, so I have to take care of myself first.
I think it's especially say post-COVID or whatever, I think we've seen an epidemic of, you know, mental health challenges of all adults, including within the health professions. A lot of people are just reporting being overworked, and all kinds of folks are reporting. I was actually just speaking with an audience about a couple weeks ago with about 500 foster parents, and talk about a group that sort of inherited all those dysregulated children post-COVID, et cetera, and the message really was, I was sort of explaining some of this, you know, do you take some time, I couldn't say it actually any better than you just said it, are you paying attention to the giver, not just to the person who's taken from you? There's gotta be a little bit of balance in that equation, absolutely. There was one other, before I get some questions, but there was also, there's been a sub-issue here also, and I mean just to name it a little bit. This idea of resilience though, I think Tera, you were sort of hinting at, and you certainly, Ben, in your description as well, and like culture, race, gender diversity, the different kinds of neuroatypicality, disability. I mean, these aren't background noise to the way mental illnesses manifest. They get into the body. They are ways, they influence the way people cope and the way we can teach them new coping skills and the toolkit that people have. And I'm just wondering if that's, you know, Atlanta is incredibly diverse as a community. I'm just wondering how that affects the work, if at all.
And it's so much fun because we get to see patients from all over the country too, but you know, in Atlanta,
Yes.
yeah, which is absolutely, you know, a very diverse place with a lot of people who have come here because of the resources. You know, I think to kind of capitalize on what Tera's saying and what we've kind of discussed already, you know, the idea that coping is probably, and resilience are probably more like a gas tank model than just a skill you have. And, you know, whether it's, you know, Tera trying to work with our alumni and make sure she takes care of herself, or, you know, any of us, especially as caregivers who like to see ourselves as being available constantly. I think that's part of the character and the role. Remembering that it is a very finite amount of energy we will have to cope and be resilient. And I think, you know, across, you know, different versions of diversity, these things, based on where you are, based on how many community support you have in that area, will either, you know, expand or shrink your gas tank. And then it's about becoming as efficient as possible too. You know, it's how big's the gas tank, and then how efficient are you? And then how well are you also able to understand when you need to do things to fill yourself back up? And, you know, again, it's just, I think that's some of the insight work we do in therapy and treatment. It's really helping people understand, you know, what the warning signs are, that they're at a point where they're not coping as well as they would typically. And again, not being self-critical, you know, again, not, you know, seeing themselves as needing to be eternally resilient, but really recognizing they may need to take some time to themselves, or go to their own therapy, or you can just take a break. I mean, it's in any given week, there are a number of times where I need to stop and pause and say, all right, I need to just make sure that I get myself taken care of first before I go on to that next difficult meeting.
And Linda, do you have any thoughts on any the diversity of your client, or I mean, incredible range of needs you're probably encountering, the comorbidity of the youth that you're encountering inside these institutions?
Well, I think that, I get distracted, but anyway.
No, whatever, take it anywhere you want.
No, I think what we need is systemic empathy. We do need to change systems. I know what it was I was gonna say. I think we can all make a contribution to a stronger sense of community and a more resilient community by connecting with each other. And there is an epidemic of loneliness. And I believe the Surgeon General has issued a report. So, and the kids, these adolescents, you know, there's loneliness for them, as well as, you know, anxiety and so on. So I think that we all can sort of support each other in very informal ways, simply by talking to the person who's picking out apples next to you at Publix, okay? Eye contact is magical. You know, and working with these kids, when we just connect, I make eye contact, and I'm totally at ease with juvenile delinquents and addicts, you know, given those folks at Thanksgiving dinner, I'd probably be happier. But if we can, I think if we can be supportive to each other, you know, people are walking around with huge burdens of trauma, actually. 82% of us have experienced childhood trauma. Now, a lot of us have also had compensatory factors where people believed in us or supported us or included us in our communities and so on. So I think those are some of the things that make for resilient individuals. But I think that simply by connecting with each other in that informal way, you know, we can all do some good. It's like paying forward, I guess. But we also have to think about systems, the systemic empathy. I mean, our healthcare systems, our structures are not really set up to be trauma informed, for example. And by trauma informed, I simply mean being knowledgeable about the adverse childhood experiences and understanding that most people have had quite a fair amount of trauma. Like a big chunk of us have had like 4 ACEs, which is ACEs stands for those adversities. So it could have been, there was an alcoholic in the family, there was some domestic violence, there was some psychological abuse. So this is us, this is not those people in some other part of Atlanta. This is all of us. So we need, I think that was like probably the most important piece of research. It was CDC and Kaiser that did that research 30 years ago. And it took all this time for it to percolate, because I worked with the very highest risk people in Atlanta. I knew this was a reality, mental illness, substance use, and adversity without those compensatory factors, right?
I actually, in terms of being in more of the resilience side of that equation of the ACEs, I always say that I don't study the bottom of the bar graph, you know, the propensity towards depression based on a high ACE score. I study the top of the bar graph. And more memorably, like, you know, you still see like 51% of people in one of the published studies by Robert Anda, right? 51% of the people with a high ACE score still do not develop depression. And actually, I had a chance to get to know Robert a little bit throughout my career and have a few conversations with him at one point. And I asked him about that. I said, well, Robert, you know, big scientists, did all the big studies, we use them, we cite them, say, how do you explain that 51% of people don't fall in that pattern? And I thought his answer was absolutely profound. He said, we don't know. You can quote me, you can tell me. And I thought it was a very honest answer, because of course, they weren't studying that. They were studying the bottom of the bar graph. They were studying the bottom numbers, like how much we're actually creating the pathology. And then I think now we're getting into understanding, building a little bit on what you're saying, we're beginning to try to understand what are these other factors that compensate for the negatives. In fact, I did, maybe if it's okay, I'll just start on some questions and we'll do some quick zingers here. And for 5 points, no, I'm just gonna. Someone asked, and this is a bit of a theme, there's a couple of themes in these, I'll try and summarize them a little bit. One was, do you have to have trauma to have resilience? And I'd say the answer, I don't think you have to have trauma, but you have to be exposed to stress of some sort.
Stressors, yeah.
Like, you know those overprotected children that we're seeing running around our communities that just are, coddled and bubble wrapped and everything else? In fact, now the research is finally coming out that's showing just how damaged those kids are becoming and how undermined in terms of their capacity to cope long-term with stress is, because they have never had to confront a challenge. Now that's not an argument, this gets twisted around, because I think we've had this conversation where some communities are repulsed by the idea of resilience, because then it's twisted around to say, are you saying that like we all have to suffer to be resilient? I'm saying quite the opposite. You don't want that, but you just want age-appropriate exposure to manageable amounts of challenge that the individual can overcome, that then builds the skill set that they need for the next difficult time. So I often work with families that are in that overprotective parenting style, and I'll say, are you getting your child ready to move out when eventually they'll go away to college, university, or just live on their own? And they're so focused on the protection, they don't sort of think of the product that they're trying to create. So I think trauma, not necessarily. Stress, probably, for sure. If I was to give you, what's the most important factor for sustaining resilience? And is there one?
Love.
Love would be a good one.
Loving other people.
Loving other people, not just experiencing it.
Yes.
Okay, go with that.
I don't think it's just one.
Yeah.
I don't, yeah.
You have your top 5? The plate
I would
pick of
say spirituality, self-love, and my support system. I think those are like my top 3. I don't know about 5, but those are my top 3.
Ben, any top picks?
Yeah, take a slightly different angle. I mean, incredibly important factors, certainly, along with the things you outlined earlier, Michael. I think leaning into stress is something that really tends to dictate good outcomes for people. Seeing stress as, again, a source of growth. Again, really, when you start to see folks who, in a lot of cases, because they haven't learned the value, again, these children who have been parented in a way that's meant to not generate eustress or distress, but no stress, And we talk about eustress as kind of the stress that promotes growth, and distress as the sort of type of stress that unfortunately can cause mental health issues and other sort of loss of resilience. But finding ways to embrace eustress, those things we can do that challenge ourselves, that allow us to grow and branch out, I think is so important. You see this kind of consistent in our patients, this consistent theme where they're the ones who are looking for hard things to do in treatment. They're thinking about their life moving forward. They're identifying those points at which they can continue to challenge themselves. Because again, if they're challenging themselves, the other challenges that the world kind of introduces become less significant. And it's funny how often, a great example is, when they take care of their bodies, they understand that while putting themselves through workouts and, eating well is stressful in some situations, it's hard, it's painful. It might be a lot better than having to deal with illness and loss of ability over the course of their lives. So they kind of lean into the stress they can control, and they end up doing well. But many examples where they can play that out in their own lives.
Yeah, and then finding those places that facilitate that, of course, as well. And we talk. I think I mentioned. We know that green spaces, blue spaces, access to active living centers, flooding a child with those opportunities actually. A lot of them will be motivated to take advantage of that. It's a bit of a back and forth game of, we offer, some will take us up on the offers and that type of thing. I think there's good evidence of that. there's other questions here, like, one of the common questions I get a lot in my work as well is, what do you do? How do you help clients in a community who have very limited resources or barriers to success, as in here in Georgia? Like, in other words, what do you do when it appears that the community offers almost nothing by way of resources? And, I mean, you're working with some kids in incredibly disadvantaged situations. I mean, you know, you're discharging them from jails often to environments where they're not gonna get much support, let's be honest, in not many cases, right? What is how do we support, how do we create community where there might not be any? Any thoughts? Or?
Well, I think that we can make magic with these kids. I think they can take on some skills to self-regulate, to regulate these tough emotions that we all feel. And I think that if they can have, I mean, all of these kids have been told that they have anger management problems, right? But what have they actually been given in terms of tools? So I think what we're doing right now is giving these kids some tools. And I think, and we're actually gonna be training them to be peer teachers so that they'll have this, you know, self-esteem increase, yes. And they seem to be drawn to what we're doing, what we're teaching. So we're very excited about that. I think that, first of all, I have to say that the families surprised me. I thought it would be very hard to get the consent of the families for their child to do a survey pre-post. Those families are on it. I get almost 100% response.
They want to help.
They want to help, and they send these adorable little messages. Tell him I love him. Tell him he'll be coming home soon. And it's mostly boys. We've got to do something with the schools. I mean, I think teachers are the most valued players in society, and we should be giving them prestige and better incomes, because we're producing kids who are gonna be at risk. You know, you've heard about the school to prison pipeline. I hate that concept, and I have to say that the Department of Juvenile Justice here in Georgia is doing a wonderful job of taking care of these kids, nurturing them. It's a school district. The entire state of 25 or so facilities is its own school district.
So
very nurturing, and you know, but they need tools for their own resilience. The corrections officers have 60% turnover every year.
I recall, adding to the story, I recall working with a young fellow who we could never quite understand why he literally threw a rock through the window of a police cruiser to get himself back into jail. And as part of his discharge, I had to go visit his mom in the home that she was living in, this kind of very, not a great situation. And she was obviously struggling, and there was a guy staying with her and stuff. And the boy, I asked to see the boy's bedroom because he was going to be discharged from the facility. We were trying to see if he's going to be stable, whatever, and trying to understand why he put himself in jail. And you can imagine the bedroom was basically the boyfriend's tools were just all over the place, and there was his mattress was this soiled mattress in the corner on the dank basement floor. And it was just a situation where, why would this kid want to ever come home to this situation? And in fact, the weirdest thing happened, that after we discharged him from the facility, he'd been in there for a few months, he actually took a bus across the city, came back with a lawn chair, I'm not making this up, and sat in the parking lot of the jail that he had housed in, waiting for his workers to come out so he could say hello to them every day. There was no other, his perception was that there was no other community. And in fact, I think what we understood from that was we eventually actually moved him into a foster placement situation. We advocated to get him a more stable living environment that was better attuned to his needs. And I think sometimes we forget that these complex problems of whether it's parent dysregulation, disordered behaviors, severe cognitive challenges, all of these coalesce into needing, we do need communities around kids. And to be fair, sometimes I think if we look, sometimes there's a distant uncle, there's sometimes a teacher, there's sometimes a clinic or a mental health professional, sometimes a youth worker who's willing to make that leap out into the community as well. Let me jump to another question. I hope I'm sort of one more question. Oh, okay. So the question is, great. How can you find resilience when you have a mental health disorder? Complication, say, and it's complicated with say a sleep disorder. Wouldn't sleep be a requirement for resilience? And I thought this was a good question because it does kind of get at the physical a little bit. That sometimes we get so much into the head and we forget good food, sleep. Ben, do you want to, from your practice, is this something you often ask people? Like, are you sleeping? Are you?
It has to be. I mean, I think where we start with treatment, and really anybody who's doing evidence-based medicine around mental health or really any physical health condition at this point, is going to start with the basics. And it's sleep, it's nutrition, it's exercise, it's socializing and being outside, all the things that, we know are healthy, we know are also sometimes hard to do, again. That's where in our treatment program we start with, both the psychiatric assessment, but also a physical assessment. And again, we're kind of putting those pieces together. And I mean, it's true. I mean, without sleep, it is incredibly hard to be resilient. So again, focusing on that and again, listening to patients and really helping them understand, number one, what their biggest stressors are. I think a lot of times people will be so used to chronic insomnia that they just, it's part of their life. But saying, well, we need to really tackle this aggressively at the outset, because if you're not able to do this, you're not gonna be awake during the day, you're not gonna be able to participate in groups and things like that to the same degree. You're just gonna be frazzled all the time. And until we get this sorted out, I don't think our chances are nearly as high if you feel the way you want to feel. I think a lot of times it's very validating, because again, I think so many people don't sleep well that, and so many people have, physical health concerns that kind of nag them, chronic pain and, musculoskeletal issues. It's, uncontrolled diabetes, all these little physical health things that will just wear on you and make it so much harder to do the work. We can take a step back and say, let's address these all at the same time. It's not let's get your depression fixed and then let's worry about your blood sugar. It's let's do it all at once, because we think they all have to be there for you to feel well.
That's a really good point. If I tried a different question, you kind of see, rather than going everyone, if you want to jump in, by the way, at any point, just flag. I'm just gonna get through some other questions, like, is it ever too late? I mean, I'll put this to Tera, I don't know why. But is it ever too late to try and foster resilience, and can it be established as an adult?
Well, I would absolutely say the answer to that is, it is never too late. When I had my mental health crisis, I was 39 years old with 3 teenagers. And I didn't know what was going on. Our life was turned upside down. And for 3 to 5 years after that, it was a challenge, and when I'm with the alumni now, they can't visualize that I was in that space, but I was. And so it is never too late. I do think that, there's layers to how well we're able to adjust and do things. And, we have to start with, what's going on with us physically and mentally. And then from there, we can create other layers as well. But it's never too late. I think that we all can, no matter what age we are, we can always learn more about ourselves and what are the things that we need in order for us to be the best versions of ourselves. So, never too late, never too late.
I think, I know my own research says much the same, is that earlier is better.
Right, definitely better.
It's, it's just easier to motivate a child to shift behaviors, and you can create environments that you can kind of do things with them. But it is a little harder to nudge along an adult.
It's harder when you're older because you're so set in your ways.
Habituated.
You've created all these, we have all these things that we've been doing for so long, and so having to make change is difficult when we're older, but it is still possible. But I definitely feel like it is easier when you can learn those things when you're younger, so.
So maybe even getting deeper into that, and maybe a really heavier question here too, what are some of the important ways to facilitate resilience for survivors of physical, sexual, and especially emotionally narcissistic abuse? Does the conversation in a sense, change at all? Is the map any different? You know, if it's more extreme abuse exposure than, you know.
Yeah.
You wanna just-
I think the priority, and the first priority changes a bit, and safety has to be the first priority. You need to establish safety first. And without that, there's no work to be done. So, you know, often we will take the first part of treatment to really just make sure that that patient is, number one, safe in the room and, you know, with us in treatment. And then we look at the environment and kind of go in outward expanding spheres to make sure that we can establish safety and, you know, a place not only to get better with us, but then also, you know, a place to return to the point of these patients who leave jail as well. And yeah, that becomes the emphasis a little more. You know, we will see many patients who are maybe on the more mild spectrum of mood disorders or otherwise, and safety is less of an issue. We can kind of get right into it. But, you know, with trauma survivors, I think, you know, validating them, making sure they feel safe in treatment is really the first step, and there is no step without that one.
Yeah, I'm glad you mentioned that. That's so critical, that you start with where people are at, in a sense of which of these factors, like a basic need like safety, is going to be maybe the catalyst for forming the relationship. I also know in some of our work, we've been writing about the differential impact, though, of an intervention. And I'm finding in some of the work we're doing that depending on the profile of risk, so if you're dealing with someone who's, say, sexual abuse, they will respond, and we're now seeing this in the addictions field as well, people will respond to a treatment in a different way. So sometimes we have someone who just isn't getting connected to a particular treatment path, and partly that might be that their risk exposures is making them less susceptible to the impact of that particular way of working. So there's some studies that we've been involved with, where children who have experienced physical abuse are much more likely to benefit from having a mentor, an adult mentor, like they might find at a choir or a sporting event. But children who had sexual abuse in their past found that they actually became more depressed as a consequence of having a mentored adult relationship, because of course they perceive the adult mentor, you know, that like if you're physically abused and then someone, you know, makes eye contact and does all the wonderful things we're talking about, you don't think your coach on soccer is gonna wallop you across the head. I mean, it's unthinkable. But what if that coach is down on one knee and making eye contact with you and creating a very, like, you're gonna go, are you grooming me? Like, even if it has nothing to, like, it's gonna be perceived and attributed, the attribution of what's happening is gonna be very different. So I guess my answer in adding to after the safety is, then the intervention is sort of like, which resilience factor is gonna depend a lot on where people are at in their healing journeys, for sure. Yeah, sure.
I just wanna make a plug for Bessel van der Kolk's book, The Body Keeps the Score. What he's saying is that we do walk around, trauma is also experienced in the body, and he says we need cognitive therapies, which is top down. Sometimes people need medication, and we also need bottom up therapies, which is sensory or body-based therapy. So, you know, we just need both. And that's very exciting. I want to say that the state of Washington has kind of been ahead in a lot of ways, and the police there for all sexual assault interviews, all of those police officers are trained in the community resiliency model, which I teach. And they use these methods with interviewees when they have to tell the details of an assault, for example. So the officer has to self-regulate. And if they are regulated, then they're, you know, so would the victim be. But they also integrate some techniques. For example, a resiliency question is, what's helping you get through this right now? So that is not focused on the crisis or the trauma. That is focused on your resilience and your survival. You made it, you're alive. You survived that experience. What's helping you right now? And very often people will say, well, my faith or my family. You know. So that's a very cool question to start asking people.
What they need most.
Mhm.
Yeah, absolutely.
Well, but it's there for them, it's in them, this resource, this family, or, their faith, for example.
Well, a couple of other questions. First of all, a quick question that I got was just, I said the phrase allostatic load, and someone that said, where do I research that term? If you just Google that, that's Stephen Hopfel's work out of Israel and Palestine, if we want to be a little topical for the moment, would answer that question a little bit on some of the studies around that. And Hopfel, Hobfoll, Stephen, Stephen.
Hobfoll.
Sorry?
Hobfoll.
Oh, sorry, did I misspell it?
Yeah, that's, no, how do you spell his name? Because
Yeah.
I'm the one who asked the question.
Sorry, Hobfoll, Stephen, yes. There's just a little different one. What's advice for loving someone with a significant other partner with alcoholism and within the same frame of resilience? And, Tara, do you wanna, and I think we have, and then we'll have maybe room for maybe two more quick questions, so I'll just ask you.
Yeah, I mean, I definitely have personal experience with that. My dad was an alcoholic until he went through recovery himself, and I think one of the biggest things that I learned, just looking at, him and my mom and how they interacted with each other, one of my biggest takeaways was, not enabling, the whole, we hear about tough love a lot, but being able to hold someone accountable and, you deciding what your boundaries are gonna be and when it comes to, how you're gonna be handling your loved one. If there's certain things that, you say you're not going to do, like one of the things that we would say is, we're not gonna buy alcohol for you. But whatever those boundaries are, creating those boundaries, but then it's so important to make sure you stick with the boundaries. Make sure you follow through with them. But I definitely would say, boundaries is very important. Also, making sure that, you take care of yourself as well when you're, in a dynamic like that with someone who's an alcoholic. And then just keeping in mind that sometimes we're not able to get our loved ones to do what we want right then, but to keep in mind that a lot of times we're planting seeds. They have to be ready to do the work, but we can plant seeds and we have to be okay with sometimes we're just planting a seed. There may not be no action now, but the action may come later, and being content with that.
And I maybe that's a great place to sort of wrap us up, because what we're really talking about then is a community of concern that helps someone overcome a mental illness. I mean, we're so far away from just that individual responsibilization idea that you are responsible for your own mental illness on your own. And I think what the field of resilience is simply saying, it's a multi-systemic idea. There's an individual, but there's also an exterior world too that's reinforcing and maybe building our best selves. And obviously that's where we're going with this. I hope you found it as interesting. I always learn a lot from doing these kinds of presentations. I love meeting everyone. And thank you to my co-panelists for doing this. And it's been a real pleasure joining you on stage here with you. So
thank you to Michael for coming all the way down from Canada to be our keynote and for doing this panel. Tera, Ben, and Linda, thank you all too for your wonderful thoughts and reflections on resilience and great stories tonight. Let's give another round of applause. And I want to thank all of you for being here tonight. You guys are our supporters in our community at Skyland Trail, and you are helping us and the people that we serve be more resilient as an organization, and we really appreciate your community, your support. I want to thank Tom and Edwina and Rex and Duval again for supporting this annual event for us. We really do appreciate it. Hope that everyone here has enjoyed the evening. Before you leave, there is a brief survey. We hope you'll complete the survey. And I think I'm supposed to say you can put your phone up there somehow, and there will be a survey that comes up. I too need IT help from time to time. There's also a green card in your program you can fill out, and we have folks in the back who will pick those up as you leave. So thank you for being here tonight. Share what you've learned. We really appreciate you being part of this important conversation. Have a safe trip home. Good night, everybody.